I want to begin this morning, though, with a critical update to a case that has totally gripped the country. Human remains have been found, along with some of Brian Laundrie's personal belongings, in a Florida nature reserve. It's not confirmed whether those remains are Laundrie's. He's been missing for over a month after the disappearance of his fiancée, Gabby Petito.
Petito's death was ruled a homicide by strangulation after her body was found on September 19th. The FBI has declared Laundrie a person of interest in his fiancée's murder. NBC News correspondent Stephanie Stanton is live outside the Laundrie family home this morning in Northport, Florida, with the very latest. And Stephanie, those remains were located in the same area as some of Brian Laundrie's possessions. What exactly did police find, and are they any closer to identifying those remains?
Yeah, good morning to you, Vicki and Savannah. I am here, as you said, outside the Laundrie family home in Northport. It's pretty quiet here right now, although there are several other members of the media. Now, the FBI held that news conference yesterday in which they confirmed that there was a backpack and a notebook belonging to Brian Laundrie, along with some human remains at the Myakkahatchee Environmental Creek Park, and that is about 5 miles from the family home here. Now, the Sarasota County coroner was called in, and at this point, we are waiting for a confirmation of the identity of those remains. Now, the park, not only is it 5 miles from the family home, but it's about 18 miles from the Carlton Reserve, and you'll recall that is where officials initially started a massive full-scale search for Brian Laundrie after finding his car parked in the reserve's parking lot there. Now, fast forward to yesterday. The Laundrie family attorney says that Brian's parents, Chris and Roberta Laundrie, set out on their own to search for Brian. They went to the Myakkahatchee Creek Park, and that is where those items were found, along with those human remains. The FBI says that they were found in an area that up until recently had been underwater. Now, the Laundrie family attorney did speak to CNN by phone yesterday, and take a listen to what he had to say.
Do they believe it is their son?
Chris, it's not about belief. I mean, as you said at the onset, the probability is strong that it is Brian's remains, but we're going to wait until the forensic results come in and verify that.
And the attorney also says that the family, which, by the way, has been very tight-lipped throughout this entire ordeal, that the Laundrie family will not be making any statements until there is some kind of official confirmation of the identity of those remains. And again, ladies, as you said, this is a case that has been gripping the nation for about the past 5 weeks. And so everyone is, of course, looking for some sort of closure.
We've heard a lot about, the family's cooperation up until this point, and this specific area that was, as you mentioned, underwater until very recently. Do you have any idea, Stephanie, how or when the family may have identified this specific location for authorities?
Well, a lot of that is still unclear, but, what we do know is the family was there yesterday. So why they were there, we can only assume that they somehow decided that they were going to search on their own. And again, we still don't have all the particulars on that, but they were there. And this is according to their attorney, that they were there around the time that this backpack and this notebook were found, along with human remains. The FBI did confirm all of this in a news conference yesterday. So it's interesting, why were searchers not there earlier? You heard the FBI say that that area was underwater until recently. It's a wetland area, so the terrain is very challenging. It's very difficult, and we are starting to come into a more drier season here in Florida, so perhaps that was also a contributing factor.
Stephanie Stanton in Northport, Florida for us this morning. Thank you so much.
Now, the FDA gave the green light for both Moderna and Johnson & Johnson to administer COVID vaccine booster shots to the public. The agency also approved the option to mix and match boosters, giving people easier access to the vaccine. The CDC is expected to discuss the vaccines later today to finalize the official recommendation for boosters. NBC News health and medical reporter Erica Edwards joins us this morning for more on this big headline that's just broken. Erica, good morning. So let's talk through this booster situation. First of all, what happens next now that the FDA has approved both of those shots for that additional dose? Do we know yet who would be eligible for these boosters, and kind of just how's it going to work? I mean, if you can mix and match, can you still get the one that you wanted? If you want the same one, do we have any idea what a rollout could look like?
Hey, Savannah, good morning. So here's who is eligible. For people who got the Johnson & Johnson vaccine, the criteria are pretty simple. Anyone ages 18 and above. For Moderna, and actually also the Pfizer booster shot, which was previously authorized, there are some different criteria. Anyone over age 65, people living in long-term care facilities, those with underlying health conditions, or those whose jobs put them at an increased risk for COVID-19 exposure. Now, as you said, the CDC is going to meet today to further discuss those recommendations. If after the CDC director signs off, those booster shots could start rolling out as soon as this weekend. As I said, Pfizer was previously authorized. 11.2 million people have already received their booster dose of Pfizer. Now, as far as mixing and matching, the FDA really left a lot of room for flexibility here. No matter what shot you previously got, you don't have to search, which Walgreens has Moderna or et cetera. Think about those long-term care facilities that we were talking about. A pharmacy can just go in with one type of vaccine, vaccinate everybody without worrying, did Mr. Smith get Moderna or Pfizer originally? One unanswered question, though, I would say, Savannah, is for people who got the Johnson & Johnson vaccine. Sure, they are eligible for that booster dose, but what if they want to get an mRNA vaccine, Pfizer or Moderna? Will they have to meet the same criteria? That's something that the CDC will discuss today.
Yeah, absolutely. That's a great question. Along with those people who I think may want to stick with the same shot. If you got Johnson & Johnson, that was only a one dose in the first place. You just want to get a second of the same. So you just mentioned how it's going to improve the vaccine process, the fact that it just makes it kind of easier. If like everybody in one place needs a booster, it can be of anyone. Do you expect that we will get any type of answers either from the FDA or the CDC on some of these questions in terms of how mixing and matching could work? If you should be looking out for the same one for any reason, you mentioned mRNA, Johnson & Johnson is not mRNA. Do you think there will be more guidance? One of the big issues throughout the pandemic has been confusion for people, certainly when it comes to the shots, who should get it, when they should get it. And this might lead a little bit more to that.
Yeah, well, that's certainly why we will be listening to the CDC advisory committee intently today, because it certainly is expected that they will address these questions. It's really up to them, that committee, to issue recommendations, really for the medical community, to give them guidance over, to how to help their patients, advise them on which shot that they may get. And, it's so hard when on a public health level to make sort of blanket recommendations when everyone might be different. Say, for example, Johnson & Johnson has that very, very rare but certainly increased elevated risk for those rare blood clots. Perhaps, in that case, as we were talking about, someone would want to go get an mRNA vaccine. So in a way, it sort of, makes things a little bit easier, but also complicates it. And that's really what we're hoping the CDC will do today.
Absolutely. You were thinking what I'm thinking, Erica, with that blood clot situation for Johnson & Johnson. So we'll have to see what happens. Quick last question before I let you go. So New York City has expanded its vaccine mandate to all public workers, and it actually includes the NYPD and the FDNY. And those are some of the lowest vaccinated groups in the city. That's actually a trend we're seeing across the country with police departments. Now, Mayor Bill de Blasio, let's quickly listen to what he had to say about this decision. We'll talk on the other side.
But every single city employee not yet vaccinated will be held to the same standard ultimately. If you're a city worker, you need to be vaccinated. We are here to keep you safe so you can keep everyone else safe. We need you to keep everyone around you in the workplace safe. We need you to make sure that people who you encounter, the people of this city, the residents of this city, are safe. Everyone needs to be vaccinated.
So one of the big changes here, Erica, is that this eliminates that testing, negative test as an option. Also, now it's just saying you got to get the shot. Do you think that we're going to see these mandates be effective in getting more workers vaccinated, or could there be pushback and people losing their jobs or quitting their jobs?
Well, there's already pushback. The city's largest police union has already said it plans to sue over the mandate. Here's what it looks like. Employees will have to get that first shot by October 29th. That's less than 2 weeks from now. They are giving a $500 incentive for workers to get those shots. It will cover, as you said, New York's police department and fire departments. Any unvaccinated employees will be placed on unpaid leave. So far, about 70% of those eligible have already received that first shot. Savannah.
All right. Erica Edwards, as always, thank you so much.
Staying with COVID-19 in the UK, cases are soaring again, with daily infections rising to above 40,000 in the past 8 days. Yesterday, Britain's Health Secretary Sajid Javid warned pressure was growing on the country's National Health Service, but rejected calls to bring back restrictions.
This pandemic is not over. Thanks to the vaccination program, yes, the link between cases and hospitalizations and deaths has significantly weakened, but it's not broken. So we must all remember that this virus will be with us for the long term and that it remains a threat. We're looking closely at the data, and we won't be implementing our Plan B of contingency measures at this point.
NBC News foreign correspondent Matt Bradley joins us now live from London. Matt, let's talk about that Plan B we just heard about. What does that involve, and why is the government unwilling to put it into action right now?
Yeah, guys, I mean, to be honest, that Plan B, it doesn't sound all that strict, especially compared to the really severe lockdown measures that we saw earlier this year here in Britain and throughout the world. Really, all it would involve are mandatory face coverings in some situations, vaccine passports, and encouraging people to work from home and communicating a need for caution. So still, the British government would still be pursuing mostly advising, mostly recommending that people take more precautions. They would be returning some of those mask mandates, the vaccine passports. You know, I was in Europe over the past couple of weeks in France and Germany, and there, where the case levels aren't nearly as high as they are in the UK, there's still quite a lot of restrictions, like mandatory mask coverings and things like that, that they really don't have here. If you walk around here in London, you'll notice that it's almost back to normal. That's because they've been relying on that highly successful vaccination campaign that the British government had been lauded for. But as you heard from the health secretary who spoke just last night, he was saying that there isn't yet what they call unsustainable pressure on the National Health Service. That's that wide safety net for all British people, providing health care universally. That is the real metric here, because the deaths and the hospitalizations are creeping up. Deaths have not shot up to nearly the height that you would see, especially last year, that we saw when case levels were this high. So deaths haven't come to match that level yet, and that's why they're not really excited about implementing further restrictions. Of course, that's attracted quite a lot of criticism. Guys?
Yeah, that makes sense, actually. Your cases may be going up, but if you have a highly vaccinated population, the serious infections and deaths would stay slow. So the UK's government, as you mentioned, heavily criticized by some over how it handled the pandemic. What are doctors and experts now saying about this latest decision? Do the public health officials want to implement this Plan B?
Well, they're basically saying that this is deliberately irresponsible. And that's some of the language that we're hearing from doctors and some of the unions who represent doctors who work in the National Health Service. And, you know, this has really created a lot of anger here among the professional medical class. Among ordinary people, it's unclear, because a lot of people really do want to see the back of this pandemic. And while we did hear from government health authorities who said that the pandemic is still with us, there's this reluctance to implement further measures. And we just heard from the head of the British Medical Association. He was speaking. He's been speaking to a lot of media over the last couple of days. Here's what he had to say.
These are all figures heading in the wrong direction. I represent doctors, and what they're telling me, especially those in hospital, is that the pressures are really building up. We're seeing ambulances now queuing outside A&E, and it's not even the height of winter. So I'm not really sure what more we need to watch and wait for. Now is the time to put in place measures to reduce the spread of infection, and in fact, try and be a nation that can compare itself to what's going on in other parts of the world.
So what we've heard from a lot of doctors is that the government hasn't learned their lesson from the past 2 years, that when you delay harder restrictions, you just get more pain in the medium and long term. Guys?
Now, we understand the UK is also keeping tabs on rising cases of an offshoot of the Delta variant. What can you tell us about that? Is it as contagious as Delta, and are officials worried?
The short answer is that officials are worried, but that it's not necessarily more contagious or more damaging than the Delta variant. It's sort of a subgroup a kind of a sibling of the Delta variant. It's called AY 4.2. It's already reached, as of late last month, about 6% of all of the viruses that have been, genomically sequenced. So it is threatening. It shows that the virus is mutating as was expected, but it's not necessarily going to lead to further infections or a more angry, more virulent virus. Guys?
Matt Bradley, live in London. Thank you so much, Matt.
Let's now bring in NBC News medical contributor Dr. Uche Blackstock for more on this. Dr. Blackstock is an emergency medicine physician and the CEO of Advancing Health Equity, and I'm sure a face that you recognize here on this show. Dr. Blackstock, is always great when you join us. Good morning. Thanks for your time. So let's pick up right there on the UK, and actually health officials in the UK are closely monitoring a new subvariant that's contributing to the rise in cases. We obviously all know about the Delta variant. I think that's something that has made so many people quite anxious. So what do we know about this subvariant? What does that mean exactly? And what should we be concerned about here in the U.S.?
Right. Thanks so much for having me, Savannah. Yeah, so we're seeing this spike in cases in the UK. We don't know whether it's due to behavioral changes, people not masking as much, or this new variant, which is an offshoot or cousin of the Delta variant. We still don't have a lot of data on it. There's some concern that it may be slightly more transmissible. However, UK is known for their robust genomic surveillance program, and they have been tracking it over the last few months. It isn't increasing at super concerning rates yet, but they are definitely keeping an eye on it. It may be contributing to the increase in cases. But as we know with many variants, they respond well to those preventive measures, masking, physical distancing, and the UK may have to put those measures back in place.
Absolutely. Something to watch for sure. All right, now to booster shots. And I've got a million questions on this, but I'll try to keep it short. So first, the information. The FDA has approved both Moderna and Johnson & Johnson for booster shots. Now that leaves the final approval to the CDC. So let's talk through. I'd love to hear from you, a doctor, of course, who we trust here, on how this would work, especially with the mixing and matching approach. People might get a little bit confused. There's already been so much confusion over the vaccines. In some ways, it can, of course, help the process. But in some ways, if somebody wants to stick with what they had, or, for example, as Erica Edwards brought up earlier in the show, you had J&J. The last time there was that concern with the blood clot. Just talk us through what you want people to know about these so that we can minimize confusion.
Right. So the mixing and matching, really the goal is to give flexibility to people and to the public. Initially, when the vaccines first came out, there were not enough supply. There was scarcity. And so I do think it's really important for people to understand that if you got an mRNA vaccine, either Moderna or Pfizer, then it's likely you should just get a booster with the same brand. However, with Johnson & Johnson, that is significantly different. We know that compared to the other two vaccines, there has been decreased effectiveness against hospitalization. And we also know about that rare blood clotting in younger women. And so it may be important for those people, based on some early data, showing that a booster with an mRNA vaccine is more effective than following that first Johnson & Johnson shot with another Johnson & Johnson shot. And so FDA is really leaving it up to the public to make that decision because we don't even have more data. And so I know that's not helpful, but what they will do is have charts available at doctors' offices and pharmacies to help the public with this decision.
Dr. Uche Blackstock, as always, thank you for being with us.
Well, this afternoon, former Donald Trump advisor Steve Bannon could take one step closer to facing criminal charges. The full House will vote on whether to refer Bannon to the Department of Justice for contempt after he refused to cooperate with its January 6th investigation. NBC News Capitol Hill correspondent Leanne Caldwell joins us now. Hey, good morning, Leanne. The committee investigating January 6th sent a very clear message yesterday with this action. How are you expecting the House to respond today? And if the vote goes through, what happens next?
Good morning, Vicki. So that's absolutely right. The committee voted 9-0 the other day. It goes to the full House today, and we expect this measure to pass. We expect all Democrats to support it, and we know that it's going to get the support of at least two Republicans, Adam Kinzinger and Liz Cheney, who are the two Republicans on the Select Committee. So once it does pass the House, which, as we said, we expect it to, then it goes to the Department of Justice. The U.S. Attorney for the District of Columbia takes up the case. And that person then decides if they want to proceed with these criminal contempt charges. If they do, well, then they form a grand jury and the case moves forward, Vicki.
Well, Leanne, we already know 2 Republicans will vote in favor of the contempt referral, Representatives Adam Kinzinger and Liz Cheney, who sit on the January 6th committee. Do you think any other Republicans will join them?
It's hard to say at this point. I asked Adam Kinzinger that the other day, and he says he thinks more Republicans should vote for it, but he wasn't quite sure if they would actually do so. We know that 10 Republicans voted to impeach the former president after January 6th, but we also know they've received primary challenges since then, and they've been bullied by the former president and threatened by him and for their political future. So it could be a very tough vote politically for some Republicans. We'll see if any of them are willing to take it, Nikki.
Leanne, we know you'll be watching and report back to us. Thanks so much.
Meanwhile, President Biden has visited his hometown of Scranton. It was his first trip there since taking office, and he was urgently making the case for his economic agenda, which has reached a critical stage on Capitol Hill. NBC News White House correspondent Kelly O'Donnell joins us this morning with the latest. Hi, Kelly. Good morning. So walk us through the president's message yesterday. Have his tactics changed as he pushes to pass his economic agenda, and really as this goes on longer than he'd ever hoped?
Well, that's the key piece there. The time frame is a frustration to President Biden, who knows that time is critical in terms of trying to get this done and trying to sell it to the American people to get them to have a better understanding of what's in it. And he also has an exterior sort of pressure. The president is scheduled to go overseas, and he would like to have results from his own agenda to talk about when he goes on the world stage, especially with that climate piece as he heads to a climate conference among the stops that he'll be making. So it's critical for the president to get this done. Changing tactics, yes. The negotiations have certainly narrowed the focus a bit, talking about things like limiting some of the key programs, perhaps the duration of some programs, and perhaps some of the ways they would pay for that, all still being worked out as the president has met personally with members of the House on the progressive side, the moderate side, lots of conversations with the 2 senators who have been key to all of this negotiation. When the president stopped in Scranton, Pennsylvania yesterday, his hometown, he gave us a sense of how he views the stakes.
The truth is, Scranton isn't my home because of the memories it gave me. It's my home because of the values it gave me. So I'm here today to talk about what's fundamentally at stake right now for the families and for our country. For most of the 20th century, we led the world by a significant margin because we invested in our people. We invested in ourselves, not only in our roads and our highways and our bridges, but on our people and our families. If we make the investments, there's going to be no stopping America in the remainder of the 21st century. It's never, ever, ever been a good bet to bet against America. No, never, never, never.
So the president trying to put some of his own nostalgia, his experience, and what is at stake for the party and the country in this argument that he's making. He'll be doing more of that, speaking tonight in a town hall and traveling over the next several days for some political events for governors who are on the ballot this November. And, of course, those races reflect what's happening in Washington, and Democrats who are on the ballot in New Jersey and Virginia could benefit if the Biden White House and Democrats in Congress can get something done. Savannah?
Absolutely. So, Kelly, let's get into some of the details here about what's still in the legislation and also how some of this back and forth is really what's created the issues within his own party. So we know the White House told the progressive wing of the party it would cut free community college from the final version of the social spending portion of the bill. This is as we've been looking for places to cut down on that cost, but take out some of those things that were really important to the progressive part of the party. How do Democrats on the Hill feel about these packages now with what's left in them and what's changed since we started this?
Well, there's a just hard real world recognition that all of the things that had been discussed can't fit into this in the practical sense of getting the votes required. So in terms of the education piece, what the president had called for was that free community college on the later side of public education. That would be put on hold. But on the front end, universal pre-K, an opportunity for children to get into a classroom earlier. That piece remains, and a real focus on on caring for loved ones at home, whether they're children or senior parents, and providing some home care benefits, as well as the child tax credit to try to continue that benefit, which is new as a part of some legislation already passed, and to keep that going to try to keep children out of poverty. Those are some of the things that they remain actively focused on. Another change could be how to pay for it, with Senator Sinema of Arizona, moderate Democrat, raising concerns about the taxation piece. And so that is something that the White House is looking at, how to pay for this without perhaps raising specific income level taxes on wealthier Americans. That is part of what's at play here, to take one thing off and to add something, as some lawmakers like to say, nothing is agreed to until everything is agreed to. Savannah?
All right. I think that describes this pretty well. Kelly O'Donnell at the White House for us. Thank you so much.
All right, let's get a check of your morning news weather now on with Bill Cairns. I'm all over the place. Morning
I
News
like
Now
that.
weather.
I like what
on
you said
News
that.
Now.
Bill Cairns, good morning.
Hey, good morning, guys. So we're watching this big, huge storm on the West Coast. And you know you have a really powerful storm when they kind of look like cinnamon buns, because they kind of spin themselves around in the middle. Obviously, on the satellite, they look white, too. I know. I don't know if they're warm and, with the sauce, kind of like the sugary sauce on top or not, but it kind of looks like a cinnamon bun. Now, yeah, oh, some pecans. Wow. We're all very hungry this morning.
We're going there.
All right, so, yes, we are. So as the storm comes on shore, we're going to see a lot of rain with it. This is how it will look as we go throughout this evening. We'll have rain all along the coastal areas from Washington State, Oregon, all the way through Northern California. That cold front will slowly move on shore, and then it'll begin to weaken. So some pretty heavy rain even through Friday. Get a little bit of a break for your Friday afternoon, evening. And then the big one, this will be the stronger of the storms, comes on shore as we go into Saturday. So what does this all mean? It means we're once again seeing significant rain today. And then as we go through the weekend, especially the high elevations of Northern California, this is just absolute gold and what we needed. And even look at this, about 1 to 2 feet of snow throughout the central and northern Cascades, too, and then through the Sierra. So the burn scars are the most vulnerable. We'll be worried about that as we go throughout the weekend, where we had some of those big fires this year. And otherwise, enjoy it, guys. Yesterday was 80 degrees at LaGuardia and Newark airports for record highs. Today, 75 in New York, D.C. at 78. Still pretty incredible that we're this warm this time of year.
Never too warm for cinnamon buns, though, Bill Cairns.
I know.
With pecans.
Sounds good. Send me some.
You seemed excited about that with your, ooh.
Bill, we have way too much fun with you, and it's only Thursday.
Yeah. Only. It's getting close, though, to Friday. All right, Bill, we'll see you next hour. Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.